Hello, I'm Felicity Cohen. I'm so excited to introduce you to my Wellness Warriors podcast. For over 20 years, I've been a passionate advocate for helping thousands of Australians find solutions to treating obesity and health-related complications through surgical intervention and holistic managed care. My podcast is dedicated to all the people, past, present and future, who have helped shape my journey and continue to inspire me to work consistently to achieve a healthier Australia in both adults and future generations. I hope you enjoy it. Welcome to my Wellness Warriors podcast. Today I'm very excited because it's not often that I get the opportunity to speak to one of the team members from WeightLoss Solutions Australia, and today we have Casey Quinn here with us. She's one of our bariatric nurses and incredibly talented, experienced in the area of bariatric nursing and looking after all of our patients, and right from the start of their journeys, which is a really unique role and opportunity to work with patients right from the beginning all the way through their journeys. Can I just start by asking, what is it that you enjoy most about working with a bariatric patient population?
I love working with our patients because I see their lives change so dramatically for the better. And it's addictive, it's amazing, and being able to be part of that journey is a privilege for me. So having that chance to really see people's lives improve, both medically, physically, emotionally, hearing their stories and connecting with them as people and as individuals is just, I can't imagine any more of a satisfying job, really. The connection and the medical, scientific, amazing outcomes for them is amazing.
I think that's one of the things that's most rewarding, is watching the change in medical comorbid conditions over time, and not just resolution, because we're not always able to cure everything. It might just be reduction in medication or change in how they feel. But the long-term outcomes in terms of prevention is a really powerful thing that we're able to achieve through bariatric intervention and really good lifestyle modification. And you know, where you sit as part of our team is so critical, because that connection with an allied health team to impact change, that's where it comes from. And I think it's important to make that point that surgery or intervention is just a piece of the puzzle, that all these other components, which is really just an incredible allied health team, they're the magic in terms of that personal relationship that you have with your patients to work over time. Because what we know about lifestyle modification, which I think is super interesting, is that statistically, if you're working with a patient for 12 months and you've got that opportunity, we know that at 12 months you can hopefully help them to not just create new habits, but that those habits will then become habits for life. So that's why that 12 months is such an important time span.
It really is. The 12 months is so important because there's so much that can change in that time, irrespective of the intervention that people have had to help manage their weight. And also a lot of the old emotions around fear of failure and sabotage and all those sorts of things can come out, and having a really supportive team there that really gets it and really understands what people are going through can take people and steer them back on track, because it can just take a moment. It can just take a moment for things to go off course. And when you know you've got an amazing team behind you and you can just pick up the phone, it really, you know, gets things going back the way they kind of need to be for the long-term success beyond the 12 months.
Absolutely. And I think sometimes it can just take one person to reach out and to connect at the right time to make the most amazing change and difference in someone's life.
Absolutely.
And you're doing that every day.
Oh, thank you. Thank you.
So today we're actually going to talk about the balloon devices specifically. And one of the reasons I really wanted to talk about balloons is because not all balloons are created equal. We've got so many on the market now. And it's a great time for us to look at how they all behave, what they all do. Essentially, once they're inserted, they all behave the same way. But would you like to start by walking us through? Maybe we can start with the Orbera, because it's the one we've had around for a long time. And at WeightLoss Solutions Australia, we've been working with this particular device since 2007.
A long time.
It is a long time.
It's a really long time. So this is an example of the Orbera balloon, but really this sort of diagram that you can see here.
Oh, and we just have to describe it a little bit for those who are just listening to us on the podcast and not those who can see us as well.
So basically, the concept of the balloon is that you put a device in that takes up a large volume of space within the stomach so that you feel fuller off a smaller amount of food. So the average adult stomach would expand to, say, 1 litre to 1 litre, 1.2 litres maximum. And with the balloon in, that takes up about 500 to 600 mils. So you're taking up roughly half of the stomach capacity. So that when people eat a relatively small amount of food to what they're normally used to eating, the stretch receptors, particularly in the upper part of the stomach, are triggered to say, hey, I'm full, I've had enough. So it becomes more tolerable to go into a calorie deficit and lose weight, as opposed to being ferociously hungry all the time in order to get the weight off. So the Orbera balloon is put in under sedation via a gastroscopy. So there's no incisions. About 15 to 30 minutes roughly, the procedure to put it in, day case, so people need to be picked up afterwards. And it's filled on the day and then kept in for either 6 or 12 months, depending on what the patient elects to do. And then it's removed under anaesthetic.
So just to highlight, so we've got this device that looks a little bit like a breast implant.
It does.
It's probably a really good way to describe what it looks like. So if you can visualise, for those just listening to us, it does look a bit like a breast implant. This round ball filled with fluid, and it's a space-filling capsule, so patients essentially just feel full. So with that, with the Orbera balloon, I just wanted to mention the difference, the 6 months and the 12 months. The 12 months is one that we have to put in a special application for.
That's right.
But that is available to patients, and many people don't actually know that it exists in those two device categories, that we can still apply for that 365, I think it's called. And that is the one that we can have in for 12 months, which is great, especially in patients who really feel that they need to lose more weight than they're going to get from a 6-month device, or they need that longer term opportunity.
That's right. It just gives you that little bit longer as well. Even if you've reached your goal weight or goal weight loss in that period, say it's 6 months, it can give you an extra 6 months to really solidify that and feel confident that you've maintained it before the balloon is removed.
So one of the other devices that we work with is the Spatz device?
So I've got the Spatz device here. So the Spatz device differs to the Orbera balloon and the other balloon, which we'll discuss soon, called the Elipse Balloon, in that it can be adjusted once it's in. For example, if somebody had the balloon put in and they felt quite nauseated, which is quite common in the early days, and they felt it became intolerable for them, they could go back under anaesthetic and have it adjusted and some of the fluid taken out, which may alleviate the nausea. But it's a little bit finicky. It does require going in and accessing a port in there. Alternatively, if people were to perhaps get to the 6-month mark and they felt like they wanted to lose more weight and they needed more restriction, you can also go in and refill it and increase the volume.
Amazing. I mean, that's just incredible technology. So it's got this external valve that allows the endoscopist, physician or surgeon, whoever's actually doing the procedure, to go back in and inflate as the patient goes. And there's no limit to the number of endoscopies in terms of to get that fill volume right. But possibly for some patients, they might find that a little bit awkward because they've got to go back under anaesthetic again. It means more time off work. And others might see that as an advantage, that you've got the potential to just fill as you need and get the weight loss that you're wanting over a 12-month period.
That's right.
Yeah, they're really interesting, different device technologies and how they all function, and the difference in, who's going to be right for what.
That's it.
And I guess that's a conversation that patients would have with you around what their own personal circumstances are, how they behave. Is it their behaviour a lot that drives you to help them make that decision around whether they need a 6-month or a 12-month, or how do you work that out?
So it's their behaviour and also their history. For example, if we have an individual, I'll use a woman postpartum, for example. She's 12 months after having her baby. Prior to having baby, she was happy, healthy weight, and she's got carrying an extra 15 kilograms that she just can't get rid of. Doesn't want to go through the process of having an anaesthetic, is just looking for sort of a more short-term solution. She may be more inclined to go for the Ellipse because, which we'll discuss in a moment, the Ellipse balloon, because it's likely to get her that weight loss, but also that individual may not have had long-term weight problems. There's been an event that's kind of triggered it. Whereas if I had an individual that perhaps has had got a little bit more weight to lose, maybe more like 25 kilos, and they really want to have that longer period of time of that sense of restriction, we may start to look more towards the Orbera balloon or the Spatz balloon, because it's going to be potentially for 12 months to give them more time to get the weight off, but also that period of time where they feel supported physically, that they're still quite full before it's removed.
Really interesting. And our programs we run for 12 months because we want to make sure that not only are patients going to get adequate weight loss during the time frame in which they have the balloon inserted, but that we're going to help them to maintain for the long term those outcomes. And I think one of the biggest fears that I hear people talk about is, what about when the balloon comes out? So for example, if they've got it in for 16 weeks or 6 months, one of their first questions might be, well, am I going to rebound and put weight back on?
Yeah.
How do you respond to that?
Well, in the first instance, I tell them that's a reasonable fear to have, because weight issues tend to come back. So there's something we always need to be mindful of and thinking about. But also, many people who have these interventions performed, they've had a history where they have had successful weight loss on diets and it's come back and it's really disappointing. So what I like to do is come up with a plan with them and go, okay, here's our plan. Balloon, this is just an example of a plan. The balloon comes out, they're often still part of the program. By the time the balloon comes out, we're still continuing with the program, so they're still working with us, but the door's always open, as you know, people can always come back and see us. But I'll say, let's give it your best shot. You will have done 12 months of amazing follow-up. You know what you need to do around diet, exercise. You'll be working with a psychologist to work with emotional eating. So let's look at it really positively. There's a good chance that you're going to do well. But we'll decide, the patient and I, on a ceiling. So we might say, okay, if you get to 5 kilos of weight regain, give us a call and we'll see what we can do, because we also have medical weight loss options that can help suppress the appetite, reset, get that, relatively small weight regain off with a medication, because it's doable with that sort of amount, and then go from there. So I actually, with any patient, irrespective of what intervention they're having, I always like to talk about worst case scenario contingency planning, and it takes a lot of anxiety out of the situation for them.
Absolutely, and I think it's fair to say that there is typically a little bit of recalibration. So when the balloon comes out, it's not unusual to gain a kilo or 2.
Absolutely.
But if you've met your goal weight and you also understand that you've got these new behaviour patterns, these new techniques, and all this advice, support, and education from a team, you've got to really be committed to the process. So
that's right.
For me, when I look at something like a balloon, it's a device, it's a tool, it's part of what we can utilise to impact behaviour modification. But the relationship that you have with the team and your commitment, first of all, to yourself, but that relationship is super critical, because there's accountability. You've got to be, first of all, have that willingness, that drive and motivation. Maintaining that, we know, is pretty difficult, and you've probably been down that path before. But if you've got this kind of accountability factor where you've got a team that you're talking to, that you're connecting with, and you know that you want this to be like no other diet has been before, and you want to be able to get that weight off and maintain it, that anything's possible, but I guess a little bit of recalibration is normal.
It is. It is.
And I think setting up patients for realistic expectations, understanding the absolute ins and outs of, I think it's great to mention worst case scenario, because we need to go down that path, and best case scenario as well, because that's also incredible. One of my favourite balloon patients lost 22 kilos and got off her diabetes medication.
That's amazing.
And stabilised at 20 kilos long term, like we're talking a few years post.
Wow.
And kept off her diabetes medication. So there's some really beautiful...
phenomenal.
Yeah, there's some pretty... that's an out-of-the-box amazing story.
Yeah.
But there are lots of those.
There are, and it's important, even if somebody were to have a sleeve gastrectomy or a Roux-en-Y gastric bypass, a more sort of, powerful permanent procedure, they're still going to have 2 to up to 4 kilos weight regain from their lowest weight. So like you said, it's completely normal.
Awesome. Now, the device that I am super excited about, and I know that half the planet is also very excited about.
Absolutely.
We love new device technology because we get super excited when there's new evolution in the world of bariatrics, and that there's new things to offer patients that
come with so many benefits. So let's start talking about the Ellipse.
Yes. So this is what the Ellipse balloon becomes.
So it's still a ball that looks a bit like a breast implant.
Yeah, roughly 500 to 600 mils.
Yeah, wow.
And this is how it starts. So basically what's amazing about the Ellipse is that there's no sort of sedation, anesthetic, anything like that happens with it. So it's you're awake.
So can we just talk about what it looks like, because we've got listeners.
Oh yes, I'm sorry, that's right.
So it's vegan.
It's vegan, yeah, that's important.
and it's a capsule, so it's something that you swallow. So and one of the main things about the Ellipse is that you swallow it. And is it right that there's no endoscopy and no anaesthetic?
That is correct. There's no endoscopy, no anaesthetic. So it's a large capsule, essentially, that has tubing attached to it. The individual swallows it down, basically. And then the positioning of the capsule is checked within the stomach to make sure it's in the right spot, and then there is fluid inserted because the tubing is coming out of the patient's mouth, which might sound pretty horrific, but it's actually not that bad. People tolerate it well. The fluid is inserted down the tubing so that then once the balloon expands within the stomach, and then the tubing is detached via sort of a trigger mechanism that pulls it out. So then the tubing comes back out the mouth, balloon's in, set in position, and people can go home.
It's amazing. And there's a second X-ray that's performed once the balloon has actually been filled with the liquid, which is a proprietary liquid. It's not just saline, but it's filled with this liquid, and obviously then we have to perform, or the surgeon and the radiology department would perform a secondary X-ray before they actually detach that.
Yeah, okay.
Yeah, is that right?
I think so, yeah.
I'm pretty sure
that sounds about right.
No, that's exactly right. So there's one X-ray performed when the balloon is first positioned into the stomach, and then post filling the device, that's when they take a secondary X-ray, just to make sure that everything's 100% fine before the patient gets up and walks out. I watched one video that showed a lady who literally had her Ellipse device put in place, and 10 minutes later she got up, left the hospital, and went straight back to work.
Yeah, that's amazing.
It is amazing, but I think also it's important for us to focus on what the reality really does look like. That's probably not going to be a common story.
Most people are going to feel quite nauseated after the balloon goes in. And look, this applies to every form of intra-gastric balloon. As you can imagine, when you have like a large foreign body sitting in your stomach for the first time, it can be a bit of a shock to the gut lining, and it could make you feel nauseated, a little bit crampy. So we make sure that we give our patients lots of medications for nausea, plenty of fluids, and then they come back to our clinic the following day for an infusion as well to make sure they're well hydrated. Typically, people feel quite queasy for the first 48 hours. It can last up to sort of 5 days, but for the most part, it's the first 48 hours.
That is so critical to understand that you're not going to just get up and walk back out of the hospital, out of the facility where you've had your device inserted and go back to work, that there's going to be downtime, that you're going to feel pretty terrible. In fact, I was here last Saturday when patients had had their Ellipse devices inserted and they came back for their fluid rehydration plus the antiemetic, anti-nausea medication that we can put in with their fluids. It is life-changing, and that's something that in this clinic environment we really stress as being important for them, because we know how much better they're going to tolerate their devices. And the important thing is we want patients to feel comfortable, to tolerate, to move beyond those early days of feeling tragic pretty quickly.
And it's amazing what a litre of fluids and some anti-nausea medication IV can do. It can really turn the corner for you. It can get you through that first 48, 72 hours where you are going to be potentially feeling quite bad, and make it not that bad really, and then you feel better. And people don't experience long-term nausea or abdominal discomfort with the balloon. It's just that early adjustment period, and then your body accepts it.
So it's pretty amazing. Once they're inserted, they're all pretty much acting the same way. They're all intragastric balloons. They all sit in the position of the stomach in the same way, but it's the actual mechanics around insertion. It's whether or not there's endoscopy, anaesthetic or not. And the fillable kind of style of balloon. So they all act the same way once they're there, but they've got their various differences and I guess points of difference that are perhaps value for patients. So
With the Ellipse device, it stays in the stomach for 16 weeks.
Yes.
What happens at 16 weeks?
Yeah, so at 16 weeks, the actual shell starts to break down and it drains. So you basically, the fluid comes out, it's completely safe for the individual, and then they pass the actual plastic, or I'm not sure if it's plastic, I'm not entirely sure. Silicone, sorry. Plastic doesn't sound good. No. They pass the silicone casing in a bowel motion, and it comes out that way. So the advantage of that is people don't need to represent back to hospital, have another anaesthetic and endoscopy to get it removed. So that's particularly useful for people who are perhaps living in more remote locations, or it's just not convenient, they don't want to come back and do that again. So that's a big plus with the Ellipse.
It's a massive advantage.
Yeah.
So first of all, it's what we call a proceduralist device, but it's a single only opportunity for them to have their balloon inserted and don't have to come back, which is, I think, for us in Queensland specifically, we've got so many remote patients. They might be FIFO workers or in the mining sector. For those people who really need to get some weight off, and I think that I've already seen so many in that patient population where weight is a problem. They get over 120 kilos, and in our experience, that can be the limit upon which they are able to maintain their workplace situation, and they may lose jobs if they get over that 120 threshold. So I've seen quite a few of those particular patients explore the Ellipse, not just because it's convenient and easy, but they only have to travel to us once. Yeah.
And there's a big cost saving in that too, because when you're the cost of regional flights and accommodation and time off work, all those aspects as well.
Time off work's a big one.
Yeah.
So when you're weighing up the cost ratio around, which one, I think there's a lot to be said for only one opportunity for having that procedure and not having to have a second event at all. Downtime from work is important, and your loss of productivity, weigh up the value and how that looks for a patient, I think is an important one to look at.
Yeah.
The other part of having this particular device, same as any procedure that we do here, is the long-term follow-up and working with the team. Tell me a little bit about what does it look like from a dietary perspective, and how do our dietitians work with our balloon patients?
Yeah, so our dietitians work closely with the balloon patients. Obviously, it's a very critical aspect of losing the weight and keeping it off. And they work closely around ensuring that they're getting adequate protein, that they're supplemented correctly. So because we are reducing quite dramatically the quantity of food that people consume, we need to check their bloods and make sure that they're not having any nutrient deficiencies, and prescribe supplements where it's appropriate, and really focus on healthy whole foods, having a healthy lifestyle, and making sure that their patients' dietary choices are conducive with keeping the weight off once the balloon is out. So sustainability of the diet that they choose is really, really important.
That's one of my favourite words, sustainability.
Is it?
Because we want to sustain our weight loss. When you're going to this effort and you're having a device inserted, and you really want this to be the one thing that ends all the diets of the past and change that story for the rest of your life, you want sustainable outcomes. And I think that the dietitians in that whole big equation are pretty critical. Their knowledge and what they can do to work with you, and I think really important to mention for people who are distance patients, that they can access their telehealth consults, whether it's phone or Skype or FaceTime. I know you have lots of patients who you work with who are remote, but you're still working with them via any form of telehealth kind of communication.
Yeah, and there's no issue with rapport building. There's no issue with connection. We still manage to really connect emotionally with people, and they feel understood and valued and supported. So whilst it's amazing to be able to meet in person with people, just a voice on the end of the line is pretty amazing. When we're all used to text messaging, having a phone conversation even nowadays is quite novel for a lot of people.
Yeah.
So there's no issues with distance.
That's fantastic. And then beyond that, we have our beautiful team of psychologists also working with patients right throughout their 12-month journey.
Yeah.
Probably one of the big things with balloon patients is dealing with eating behaviour problems. So for example, if they're an emotional eater, a comfort eater, boredom eater, stress eater, whatever those triggers are, that the psychologists are pretty good at working through how to manage those concerns.
They are, because they specialise in weight and body image and issues around food. So they're very, very skilled, qualified psychologists, but then they've got this sort of specialty stream in this line. So they're so familiar with the stories. And whilst everyone has an individual story, often the themes are pretty common that come forward around emotional eating. So what I love about the psychologists that we work with and work with our patients is patients are always in really good hands and they're very safe emotionally. And then that allows people to make progress.
I'm loving where we're going with the balloon technology and what we're able to offer our patients. And I can see that it's become so much more popular. I think that's just because of the growth in device technology available. And that people are really latching onto the whole idea of the Ellipse specifically has drawn a lot of attention to balloons, their potential and what they can achieve. So I love that we can do something that's non-surgical or non-interventional for the right patient. And that's another point that I just wanted to discuss with you, that really carefully assessing right patient for the right device or right procedure to match their goals, their expectations, their medical needs is really important, because we want to deliver outcomes. And we actually don't want patients who are not suited for a balloon to opt for it because it sounds like it's easier or that it sounds like it's more affordable. So what I wanted to touch on is that you're the perfect person in the first instance to really help understand what does that look like, because so many people will come in thinking, oh, I feel like I can go with a balloon because it's not surgery, and that eliminates the fear around surgery. But if they really are a surgical candidate, the last thing I would want to see for a patient is invest time, money, and that's a big thing, the financial investment. If you invest in the wrong procedure, what happens? You're back here 12 months later or 2 years later, or maybe you go somewhere else because you're embarrassed because you need a secondary procedure. I don't want that for anybody. What I really want is to know, and if it was me as a patient too, that I've got a team of experts who are going to guide me around the best decision for me.
That's exactly right. I think I would go one step further. My biggest concern around people not being well informed and going with an intervention that's perhaps not powerful enough for their needs is that they hung that as their last hope, and then they just give up altogether because they think, okay, I can't be helped, it failed, that's it. But they were actually not set up with the right intervention in the first place. So honesty and integrity around the benefits and the limitations of the balloon is really important in that initial assessment that patients have with us, the nursing staff specifically. It is reasonable and sensible to say, I want to do the least invasive, the least risky intervention. That is human nature, and I think that's, in a lot of ways it's smart. But when it comes to weight issues, we sort of we have very good data around what interventions work in what category with what sort of a person's weight loss goals are, essentially. So we'll work really closely with individuals in the initial assessment to sort of ascertain why they want surgery in the first instance. Is it to get down to this weight? Is it to reach a goal weight in order to have a knee replacement, for example? So where are they at? Like, what's actually driving them to want to have an intervention to help them lose weight? And then give them an honest appraisal of what weight loss is realistic, and try to steer people closest towards the intervention that's going to give them what they want. If a person perhaps is a much better candidate for, say, a sleeve gastrectomy, but they're just not willing or not in a position where they want to go down that path, we're not going to rule out the balloon, but we're going to be very, very honest and make sure that there's, once again, a worst case scenario pathway of where do we go from here. Hope for the best, plan for the worst if someone wants to have a balloon, but it may not be the number one intervention for them.
I think that's really wise, because a patient wanting to lose 50 kilos choosing a balloon needs to understand that it may not deliver that. And it's not actually intended for that.
That's right.
But on the other hand, it could be the thing that kickstarts their progress and gives them that opportunity to get there. So it's up to you and the team to help guide and direct that decision.
That's right. It may be an individual needs to lose 15 kilos for a hip replacement. They may benefit from losing 50, but the 15 might be enough to get them the hip replacement. That might improve their pain, then they're more mobile, and that could kickstart further weight loss for them. So it's a bespoke individual assessment that needs to happen for each individual. We don't just go this for you, just based on purely on weight.
or on patient desire, who, you know, they show up and say, I want a balloon.
Exactly.
It doesn't work that way.
No, it doesn't.
And I know that might sound awful, because so many patients, especially Queenslanders, they're super well researched, they're very well informed, and they have a lot of information at their fingertips that helps them kind of already decide before they get to us sometimes around what they want. But what they want might not necessarily always be the best option. So my, I guess, best advice is trust the process, trust the team, and work with them to help you make a best guided decision. I also love that you touched on orthopedic procedures, because I really feel like that the balloon is such a well-positioned device to help patients when their orthopedic surgeons are saying, I can't give you that knee replacement or the hip replacement until you lose 20 kilos. You need to go away and lose that weight. And I've had so many phone calls with people who've just thrown their hands in the air and they've tried everything before. It hasn't worked, but they're desperate for that orthopedic procedure that's going to be life-changing for mobility, for functional fitness, for pain.
That's right.
And I think this is a really good opportunity to help them get to that point where they can have those procedures.
Yeah, particularly the Elipse balloon, because you're not needing to go back in for an anaesthetic again. So you can plan your surgery closer. So you might have it planned at 5 months with the Elipse lasting for 4. You know, you can kind of have that closeness there because there's not another surgery that needs to be scheduled.
Oh, and there's no anaesthetic. So
there's no anesthesia. Yeah, exactly.
That's amazing. I love that.
Yeah.
Awesome. Well, I'm super, super excited about all of the things that we can do for patients with balloons. You did also mention medical weight loss. So in some instances, we might use a combination of therapies where we might include some pharmacological intervention, where the GP might recommend some form of medication to go with the device to give more power to that weight loss. What can you tell me a little bit about medical weight loss and how that would work with a device like a balloon?
Yeah, so medical weight loss is essentially medications that we prescribe that help suppress the appetite. And it's important to touch these medications aren't things like Duromine. So they're not medications that affect sleep, mental functioning, anything like that. They're particularly good for people who have perhaps a smaller amount of weight to lose, which we've got for our medical weight loss program, or for people who need to sort of get that little bit more weight loss on top of the balloon, or they want to use it when the balloon comes out or deflates as a way of kind of helping to manage their appetite. So they're powerful medications, and I think that in the future they will become regular medications for people once they're better subsidised by the government, because they're fantastic for helping maintain, in particular, weight loss.
Absolutely, and I love that we can use them with a device to help get better results. The other thing about the medical weight loss drugs is that there's so many different ones that where the GP and the medical team are able to work out which ones might interact with medications that people are currently taking, so they can adjust and change accordingly. So there is typically a pharmacological treatment option for pretty much any patient. But we've got to have a really good understanding of all of their medical conditions and the medications that they're currently taking, so that the GPs can prescribe appropriately. Fabulous. Well, I'm excited about balloons.
Me too.
And I'm excited about the opportunity, Casey, for you to see many more patients and help them along their journey, because you do so much to help them.
Thank you.
How do you, so let's just move off balloons for a second. So tell me about how you actually manage your working life and being a mum and all the other things in life that you love to do. What for you is work-life balance, and how do you manage it?
So work-life balance for me, I realised some time ago that happiness for me is an equation. It's about making sure that I'm getting enough rest, that I'm exercising, that I'm surfing, that I've actually started journaling, doing a gratitude journal, thanks to you, Felicity, which has been amazing. So trying to get that work-life balance initially starts with me. And being a mum, as all mums can understand and attest to, it's really difficult to make time for yourself because you feel very self-indulgent and extremely guilty about it. So for me, it's been about, first of all, making sure I'm mentally sound, that I'm physically healthy, and listening to other people's advice who've walked in my shoes before. And just because it doesn't feel natural doesn't mean it's not good for you. And eventually when you start making the right choices, you feel a lot happier for it, then you feel more entitled to take that time for yourself. I find work a relief. I don't find work draining ever. When I come and work with patients, they say like do a job that you would do for free. I honestly would do this job for free. I love it so much. So I feel energized at the end of my working days. It's probably more about managing, putting on the different hats and making sure you're meeting everybody's needs in the workplace and being a good mum. But I just start by trying to be healthy within myself and be authentic, and things flow on from there. And you're so amazing. Like, you're the most like genuinely mother, family friendly person to work for ever, which is so true. So you make it easier for me, to be honest. Like, a lot easier.
Oh, thank you.
Because you never make me feel bad about being a mum or having other needs elsewhere.
But and nor should anyone, you know, having children and running your life and managing work and fitting everything in, putting all those pieces of the puzzle together, it's not ever going to be easy.
No.
But I think you're doing an amazing job.
Thank you.
And, you know, doing an amazing job at every single thing that you do.
Oh,
and you've got the most gorgeous little boy. We love him. He should come to work more often.
He loves it.
It's so much fun having him around.
Oh, thank you.
Yeah. Thank you for being here today.
Yeah, thank you.
I do have one last question for you that I like to ask everybody who comes on the Wellness Warriors podcast. Yeah. What does wellness mean to you?
Wellness means to me feeling excited about life, starting the day feeling excited, just feeling open to everything coming your way. And you can only feel that way if you're not in pain, if you're not thinking about your body, you know, like if you're just kind of fresh moving forward. So when my body is a healthy vessel, I can do that. And when it's not, I really notice. So I don't even know if that makes any sense, but...
Oh, I actually love it. I love that you need to be excited. I love excitement. It's the best thing ever. You wake up and feel awesome.
Yeah, and you know those days where you feel like that, and it's not wellness every day for me, but I'm trying to make it that way.
I think that's a really good message, that you can't have that every single day of your life, but you can strive for it.
Yeah. If you don't strive for it, you're not even going to get close.
Love it. Thank you very much.
You're welcome.
Thank beautiful nurse Casey Quinn. Thank you for joining the Wellness Warriors podcast. It's been a pleasure to have you online with us. If you enjoyed the series, please leave your review, subscribe and follow, and we look forward to sharing many more stories with you in the future.